Have you ever wondered how a small cut turns into a neatly healed wound with just a few stitches? Stitches, also called sutures, are medical threads used to hold the skin together while it heals. They act like tiny bridges, letting your body repair itself safely and efficiently. Not all cuts need stitches, but deep or wide wounds often do.
The first step is always cleaning the wound to prevent infection.
Doctors use antiseptic solutions to remove bacteria and debris before stitching. Once the wound is clean, the doctor chooses the right type of stitch for the injury. Stitches can be absorbable or non-absorbable, depending on how the wound heals. Absorbable stitches dissolve over time, so you don't need a follow-up removal.
Non-absorbable stitches remain until a doctor removes them after proper healing.
The needles used are usually curved, allowing precise placement without enlarging the wound. Each stitch pulls the wound edges together, aligning the tissue perfectly. This alignment reduces scarring and accelerates healing. There are different stitching techniques for different types of wounds. Simple interrupted stitches are the most common and easy to remove. Continuous stitches are used for long wounds and provide extra strength. Atras stitches are used for deeper layers to keep internal tissue aligned. Subcutaneous stitches sit just under the skin to support the surface layers. Some stitches are hidden beneath the skin, so they aren't visible from outside. Doctors choose the stitch material carefully. Some dissolve, others stay until removal.
Sutures can be made from natural materials like silk or synthetic ones like nylon.
Absorbable sutures are often made of materials like polyglycolic acid that break down over time. Non-absorbable sutures can be made from materials like nylon, polypropylene, or silk. Doctors select suture thickness based on the wound type and location. Thicker sutures are used for areas under more stress, like joints. Finer sutures are preferred for delicate areas like the face to minimize scarring. The type of needle used also matters. Curved needles are common for most suturing. Tapered needles are preferred for soft tissue to minimize trauma. Cutting needles are used for tough tissue like skin or tendon. Suture technique affects healing. Some stitches close wounds faster, others reduce tension. Interrupted stitches are placed individually, allowing precise tension control. Continuous stitches run in a line, closing the wound faster but with less individual tension control. Some stitches are placed deep to bring tissue layers together and prevent dead space. Surface stitches close the skin and are often removed once healing starts. Some stitches are placed in layers, deep tissue first, then skin, to improve healing. Knots must be tied securely to prevent stitches from loosening during healing. Surgeons use specific knot types depending on tissue type and suture material. Surgeons often practice knot tying techniques on models before working on real patients. Proper tension ensures the wound edges stay together without cutting into the tissue. Surgeons check each stitch to ensure alignment and prevent gaps that can slow healing.
Again at the Cohens. Absorbable sutures dissolve over time, reducing the need for removal.
Non-absorbable sutures require removal once the wound has healed sufficiently.
Surgeons select suture material based on tissue type, healing speed, and patient needs.
Choosing the right suture length ensures enough material for secure knots without waste. Different suture patterns distribute tension differently, affecting scar formation. Interrupted stitches allow some movement of tissue, which can help certain types of wounds heal better. Continuous stitches are faster to place, but must be done carefully to avoid uneven tension. Surgeons monitor the wound as stitches are placed to ensure proper alignment and tension. After all stitches are placed, surgeons inspect the wound for any irregularities or gaps. Properly placed stitches speed healing, reduce infection risk, and leave minimal scarring.